So good morning. This is Linda Kopecki. I think we'll get started. Welcome everybody to the winter 2020 Winter Teleconference. This is the second teleconference of this year, and we're excited to have a second one. When we had our first teleconference in oh gosh, was that April or March? It seems like a lifetime ago, pretty much, with the pandemic. The group opted to have a second teleconference, and it's later in the year than we had hoped, but here we are. And this is going to be a summary of the summit and sort of a follow-up to the Perinatal Hospital Leadership Summit. So when we get started, I want to start quickly with an acknowledgement. The Minnesota Breastfeeding Coalition acknowledges that while this is a virtual conference and teleconference, all of us are standing on and living and working and playing on land that is unceded from Dakota and Ojibwe communities. Indigenous people have lived on this land for millennia, and their babies have thrived on breast milk. It is only a small portion of our history that not all babies are surviving and thriving on breast milk, and colonization, forced family separation, historical violence has robbed Indigenous communities of that tradition of breast milk being the first food. So Minnesota Breastfeeding Coalition dedicates itself to accompany our Indigenous sisters and brothers and brethren on the journey towards a day when breast milk is that first food for every baby, and they have the chance to live and survive and thrive. And we commit ourselves to being truthful, being honest with each other, and reconciling with each other. The agenda is here. It's just an hour and a half. It's a quick teleconference over your lunch hour. Really glad to have you here. Please, again, put your welcome in the chat section. Let us know who you are and where you're hailing from. If you just have your first name on your little thumbnail photo, could you put your last name, please? We are using breakout sessions today, and we're dividing folks by region. And so my esteemed colleague, Carrie Clun, is going to be dividing everybody into the breakout room by region, and having your last name will be really helpful. And just want to quickly acknowledge this is how we've divided everybody so far. We'll have breakout rooms where you can have a conversation about the topic that we're discussing. If you do not see your name, please put in the chat section which region you would like to be in. We had a few people who were registered who we could not quite figure out where they lived. So if you do not see your name on this list, please put your information in the chat section. And I see people are starting to populate the chat section. Thank you very much. We appreciate it. I'm gonna give you another minute to look for your name. That's going to be your breakout room. And if you do not see your name, please put your desired region in the chat section. Just going to give this one more second. So I said this is a follow-up to the 7th Perinatal Hospital Leadership Summit, and I'm going to provide a very, very quick 5-minute summary of the 2-day summit. I don't know if it'll be exactly 5 minutes, but just to let you know the what we covered. And you can access the slides, the PDF slides for the summit. If you want to review it, you can also, if you did not attend a summit and you want to acquire the CMEs or the LSERPs for the summit, you may also, it's only $30. You can register to receive the recordings of the summit, and then you can take the evaluation, and you can, then you can receive the LSERPs available through the end of July, and CMEs, which are for physicians and nurse practitioners and midwives, those are available through January 6th, so just another month to receive the CMEs. So once again, welcome. Put your welcome in the chat section. Welcome to the teleconference. And if you do not see your name on here, these are the breakout rooms for discussions by region. Please, in the chat section, put the region that you desire. And if your last name is not on your little thumbnail, please add your last name. That helps us put everybody in the right breakout rooms. So before we get started, I'm going to quickly do a very quick summary of the summit. So we started with Dr. J. Kim from Cincinnati and why human milk matters. So all about human milk, the biology of human milk, how it's used, just why human milk is so important. And then we also talked about the how critically important human milk is in helping babies not just survive but thrive, especially against neck, which is necrotizing enterocolitis, and other conditions, particularly with preemies. We talked about milk banking. These are slides from these are images from the milk bank in Texas. And then we talked about our own milk bank, which is brand new here in Minnesota, the Minnesota Milk Bank for Babies. We discussed local and state level infant mortality initiatives. At the state, they're doing quite a bit of work on safe sleep. And locally in Ramsey County, the Birth Equity Community Council is partnering with them. On the second day, Dr. Bobby Phillip gave us a lovely history of the Baby Friendly Hospital Initiative, reflections on BFHI over the past 20 years with the Boston Medical Center. Then we discussed the 10-Step Learning Collaborative in Minnesota. This is a map of the baby-friendly hospitals and those that have historically been baby-friendly hospitals, and then those that are engaging in the 10-Step Learning Collaborative, which are the red stars. We discussed the Minnesota Breastfeeding Coalition hospital survey that we've done each year, and it's practices, but also barriers or challenges to achieving those 10 steps. Then we centered on Centricare, and colleagues from Centricare told us about two initiatives that they have been working on, which is Purple Crying and the Special Care Nursery. And finally, Dr. Phillip came back and spoke about Early Bloomers program that they have for early preterm infants. And the emphasis of that was really about how do you lead a community through change? How do you lead the hospital community or a team through change? So I am going to invite Marcia McCoy, our first speaker, to pull up her slides. I will stop sharing, Marcia, and you can pull up your slides. And we would love to get started on the first session, which is all about data. So we're all from different coalitions, different types of coalitions, and Marcia will be speaking on how we find data that we need. So Marcia McCoy is a WIC epidemiologist with the Minnesota Department of Health.
Good morning, everybody, and it's so nice to see so many people joining us today. I think that I'm so immersed in breastfeeding data all the time that I sometimes forget that not everybody has been looking at this data for years. And I think not everybody is aware of what data is available as long as you have internet access. And so I'm just going to take a few minutes today to kind of walk through a few of the available data sources, talk about some of the good and bad, and also then we're going to have some time for people to go in the breakout session and hands-on go in and look for data. And then I'm hoping also that people in the breakouts will talk about, you know, what kind of data would be most useful for you, where are there gaps, and I really invite people to contact me if they have questions about data that I'm not sharing today, or if there's something that I could help them with, because I'm always happy to do that. So, you know, data is my job and what I do all the time, but it's really not an end in itself. It's the starting point. We use data to figure out what is happening in our state, in our local community, with the moms that we serve. And it should be a jumping off point. It's a way to identify where we have areas that we could work on, making things better. So what data are we interested in? Breastfeeding rates, hospital practices around infant feeding, formula supplementation, disparities. And in Minnesota, we have both some racial or cultural disparities, and we also have geographic disparities. We're interested in where can people find resources, and where can people find allies to help in their work. And I'm not really going to cover the resources and allies, but it's something maybe in your breakout you could also talk about if you wanted. So there are a few national sources online for hospital practices and for breastfeeding rates. I think when we first started working with the Minnesota Breastfeeding Coalition way back when we had our first couple of meetings, we were armed with the MPINK survey in one hand and the Surgeon General's call to action on breastfeeding in the other. And that was published in 2011. And it's still a great resource because it has ideas for different areas that you can choose to work in if you want to make an impact on breastfeeding. So the MPINK survey is still going on. It gives you a picture of how your state's hospitals are doing overall. However, it does not provide any information on individual hospitals because the individual hospitals are guaranteed anonymity when they take the survey, just to encourage people to be honest about what's really happening. We have looked at MPINK surveys across the years, and there is in fact a fact sheet in the WIC breastfeeding data about the MPINK survey in Minnesota. The format changed in 2018 though, so the next MPINK survey we should be able to compare to this most recent one, but this most recent one isn't really comparable to the earlier ones, but it's definitely something to worth checking out. And then for breastfeeding rates on the national level, the information that goes on the CDC's breastfeeding report card and on other reporting is actually developed from the National Immunization Survey. And they collect data on a lot of things, and some of those include breastfeeding rates. And these are surveys that are given to parents when their children are, I believe, 18 months to 2 years, sort of around that area. So there is a little bit of lag from the time that babies are born until these rates come out. So the most recent rates that are available right now by state are for 2017 births. And they do also collect information on in-hospital supplementation with formula of breastfed babies, but that data unfortunately is not available on the state level. And then PRAMS is also a nationwide survey that it differs from state to state in which pieces of data they're collecting. And when I went and looked on the PRAMS site, there is a report for 2016-17, but not for Minnesota for some reason. The most recent report for Minnesota is 2015. So I have asked somebody here that works on PRAMS to help me understand that, but I think they're reassigned to COVID right now, so I haven't heard back from them. But PRAMS does have information about births and about infants and parents in Minnesota. So Minnesota WIC, a few years ago, we started publishing breastfeeding data for all infants born in Minnesota, just because there was no state source other than the National Immunization Survey. And so WIC has acquired the Minnesota birth certificate data, and we have calculated the rates according to the birth certificates of how many infants are breastfeeding in the hospital. And so these reports are available by county, by region, by community health board, and also there are totals, and then there are rates broken out by race, ethnicity, and selected cultural identities. So right now, WIC reports on, it divides Asian into Hmong and non-Hmong Asian, and it also reports on East African breastfeeding rates separate from multi-generational African American rates. Why you would choose to look at region for places that have smaller populations, the region gives you a better idea of the trends if you're looking from year to year, sort of what's happening in your area. The ones, most people look at the county rates. Community health boards, it can be helpful, especially, for example, like in Hennepin County, it's divided up into community health boards, so you can actually get rates for Richfield, Edina, Bloomington. They're broken out a little bit farther than just on the county level, just because Hennepin is such a populous county. And then if you have a contact with WIC in your local area, WIC also has access to that data by WIC agency and grantee, and they also have information on tribal WIC agencies. The reason why we thought that it was important to publish these rates is that with the Minnesota birth records, we have the actual, we can count all the babies in Minnesota and whether they marked on the birth certificate, whether they were breastfeeding or not. When you look at the National Immunization Survey, you can see that for Minnesota, the most recent data is based on a survey of 256 babies. Whereas for the birth certificates, we have it on all 65,000 babies that were born in the state of Minnesota. So it's just much more accurate. According to the National Immunization Survey, we have higher rates than we actually have, just because the survey is not precise. So we really prefer people look at the actual numbers from the birth records. When you look beyond breastfeeding initiation, most of the data that we can find is only on WIC participants. There is one exception here, which is, there are a few exceptions, but if you look, I'm just pointing out one this isn't directly breastfeeding, but this does give a picture of how many of the babies that are being born in your county, your CHB, your region are participating in WIC, and whether those parents are participating prenatally or only after the baby's born, and what type of insurance coverage they have. So we at the state office look a lot at the numbers for Medicaid births that are not on WIC, because any person that gives birth in Minnesota who is on Medicaid is automatically eligible for WIC. So we, when we see people who are on Medicaid and are not participating in WIC, that is, we focus on that for some of our outreach efforts. And then we have the WIC breastfeeding reports and data. And what's different with this is that we can report on duration in addition to initiation. The birth certificate data, which is for all Minnesota infants, only tells us about whether the baby was ever breastfed. And after that, the only data we have on duration would be from that National Immunization Survey or looking just at WIC participants. And what we know from about the difference with WIC participants is that participants in Minnesota WIC have lower breastfeeding rates than the general population, because they are populations that have more barriers to breastfeeding and more challenges with breastfeeding that's related to low income and other factors.
Marcia, there's one question that came up in the chat section. I just want to,
please do,
because I think you can answer it pretty quickly. Which of this data is on the birth certificate? Is WIC data, breastfeeding data? What all is on the birth certificates in Minnesota?
The birth certificates have information on the pregnancy, the birth, the baby's weight, the mother's weight gain, and there's a lot of information actually. But for the breastfeeding, they just have ever breastfed, and then still breastfeeding when they left the hospital, which is pretty much exactly the same. And the birth certificates do also, in addition to the standard race ethnicity, they do have check boxes for a lot of different countries of origin or cultural identities. And I encourage you, when you go into the breakout session, click on the link and go look and see what those reports look like that we publish on breastfeeding initiation. Another area that for me personally is frustrating, because I'm very focused on infant feeding during the hospital stay and how could we do better at increasing the amount of exclusive breastfeeding in the hospital stay and after the hospital stay. And WIC is the only source of pretty much the only source of data on exclusivity during the hospital stay. So not all WIC agencies collect that data, just some of them. So, but you can go and look and see if your county has data on exclusivity. And you can see here, the trend is generally downward in that fewer babies are being exclusively breastfed in the hospital than have been in the past. And this is happening across race ethnicities and in general in Minnesota. And this is how the exclusive breastfeeding during the hospital stay rates look by region. This is not published anywhere online right now, but I'm hoping to put something on this soon. And you can see that we're concerned about what's happening during COVID too. So these are the partial 2020 numbers are included. Minnesota WIC also has trends, maps, and I really encourage people to look at the breastfeeding fact sheets, because with those we try to bring together the most important information we see from all this data that we have on breastfeeding, and kind of what we see as the most important trends and maybe some interpretation of what we think is going on with why the breastfeeding data looks like it looks. And if you go through all of these areas you can't find the data that you're looking for, we do have now online forms where you can request data. So if you would like to see some data in another form or for a specific group, something like that, that if you're a local WIC agency, you can use the local agency reports and data request form to ask for data from the state WIC office. Otherwise, if you're a local coalition or a hospital or anyone else, you can use the data request for the Minnesota WIC program form to ask for data. And whether you'll get it and how fast you'll get it really will depend on one, how difficult it is to get the data, and two, if we feel like your request is something that would be useful for more than just your organization, it'll get the highest priority. So if we feel like, one county requests some data that maybe lots of other counties would be interested in also having, then we would prioritize those kind of requests. So I guess that's a lot of information in a short amount of time, but can I answer any questions from anyone about?
There was one more question, Marcia, and it was back to the birth certificate. Is it on the, which copy is it on? Is it on the parent copy or the electronic copy that's in the system?
Oh, we get the electronic birth records, and so they have more fields than you would see printed on the paper certificate.
Okay.
But I would suggest, email me if you have specific questions about you're looking for certain things from the birth certificate. It's a lot of fields, and we don't take them all, but we did recently add in death records as well. So we're going to be trying to do more with looking at infant mortality and morbidity.
Great. I think we're going to go straight to breakout sessions. There are a couple people that we're still trying to place into breakout sessions. Somebody's on an iPhone. And if you are able to just put in the chat which, around what part of Minnesota you live in, so we can put you by region. And then there's at least one name, maybe a couple names that don't really have your first and last name. So we're trying to place everybody by region. But we'd like to move to breakout rooms really quickly, and please discuss all this information about data. The theme of this teleconference is really how local coalitions and how coalitions can partner with maternity centers so that we can collaborate to improve optimal infant feeding rates. And so when you're thinking about data, what data helps you support your maternity center? What data at the maternity center level helps you be a better partner in the community? Okay. Welcome back, everybody. I see you're joining us again. I trust that you had good conversations with folks in your region about data. Slowly, folks are coming back. So welcome back, everybody. Our next section is going to be a quick piece about milk banking. That was definitely a big topic during the summit, was the value of human milk, value of pasteurized donor human milk, milk banking. Wanted to give you a few tips as coalitions, local, regional, and cultural coalitions, provide a few tips for related to milk banking that you can use. I'm going to stop share because Linda Deck is going to open up the milk banking slides. But just some information on starting a milk depot and how to get access to our partnership going with the milk bank.
And I was just going to reiterate for people, if they have questions about data, please get a hold of me.
Marcia, feel free to, I know you probably did, but feel free to put your email address in the chat section again. Thanks, Linda Deck and Jean Freeby and Jason Foss. There you go.
Yeah, so this is Linda Deck, and I have, now that I'm sharing the slides, I can't see the chat box. I'm not even sure if Jeannie is on.
We'll watch for you.
Okay. So before the breakout rooms, I didn't see Jeannie on them. So if Jeannie wasn't available quite yet, Jason was going to kind of start.
All right. Until Jeannie gets here, I'll just start to go over some of the basics for this. But my name's Jason Foss. I'm the depot coordinator for the Minnesota Milk Bank for Babies. And pretty much what I do here is set up different milk drop-off sites for donors around the state to drop off any of their extra donor milk that they want to donate.
And I'll try to forward to the slides that you would talk about.
Okay, so there we go. So in order to get started with this, the process of setting up a milk depot, really the first thing to do is to get a hold of us, specifically me. And you can do that by either calling or emailing me. That information will be on the last slide. And we can start to talk about what's necessary in order to get your milk bank going, or your milk depot going. So the first thing is to go through an agreement. Pretty much this includes all the information that you'd need on what's required, what we expect, and what you expect of us as we go through the process. And really, there's a few things that we go through in that. The first thing is setting up different depot coordinators for your site. It's always nice to have a couple who know what's going on there. Most of our depots, we have a few people who are aware, if a donor calls, they're able to handle that donation coming in, or get a hold of someone saying that we need to transfer some milk from the depot to the bank. So a few people that know what to do there. So those people will be involved in the signing the agreement and just getting things started. The next thing that's important is the freezer. And so there's a couple different ways that we can go about getting a freezer at your location. We do provide a freezer if one is not available. Some facilities happen to have just an extra freezer line on that needs to be used, and that's a good way to get it back into working order. So usually with our freezer, we go for about a 9 cubic foot freezer, 11 cubic foot freezer. Those are best for the kind of milk donations that come in, and really most space efficient in facilities usually. And then within the freezer, we have to have a temperature tracking system. And so you can, if you do have a temp track system at your facility, you're able to just hook that up and have it constantly monitoring the temperature in there day by day. Or we can provide a thermometer to you and you take a manual written record every day. And so with that, the record keeping, we would like to see, again, the temperatures being recorded every day, just so that we know that there's no deviations from the temperatures that are expected. So usually about 0 degrees Fahrenheit or negative 18 degrees Celsius. And if there is a deviation from that requirement, then there's a spot in there to record, how that was solved and what was done, or if you had to contact us in order to get that problem fixed. The other record keeping is making sure you know which donors are dropping off and when. That's pretty important for us to keep those files just so that in the end, when everything is transferred over, everything matches up. We know that this donor dropped off where she was supposed to, and everything comes in accordingly. And then finally have our milk transfers to the milk bank. As you can see in our picture here with our 100th donor, there's a little blue bag and it's kind of cut off, but it has some of her milk in there. And then I have one with me here now. It has a little white tag on the donor number that's assigned to the donors when they're approved, will be written on that white tag. And that's when written on the white tag by the depot coordinators at the depot. And then that can be stored into the freezer. These blue bags make it nice and easy to store the milk, but then on top of that, transfer the milk to the milk bank. These things keep the milk frozen for a very long time. So some of you that are curious about getting started with milk depots and are a little bit further out there from the Twin Cities, they do hold pretty well. So there's not too much of a concern of transferring the milk over, whether it's through car or through plane. So Linda, if you want to go to the next slide here.
Yep.
Okay. So we currently have 24 depots in the state of Minnesota. So, you can see where we tend to pack them in. There are a few different places where it would be very beneficial for us in the communities to have one close. We really want to make sure everything is very convenient for our donors that are donating. And in some of these places, it's just a little bit further out. So you can see we've almost got to Canada on one of our depots. So we've got a little bit of that place covered, but there, you all are in these different regions of the Northwest, Northeast, and Southwest, can see that there is a need for depots in those areas. And it seems that once these depots open in these further away areas, for example, in the southwest corner, there's Pipestone, we start to get moms that show interest in donating. A lot of them just don't know that they can, or it seems too far away until something opens up next to them and they see that. So for the most part, expanding our reach out to these different regions is really beneficial for everyone, and it's a good way to communicate with your community and really get your name out there with them. Start to establish closer relationships with these. We have a lot of donors that are really excited about donating, and once they finally do, they feel very satisfied with what they're doing to help out others.
And Jason, can you just share a little bit about how the milk gets to the milk bank?
Yes, so I kind of touched on two different ways that it can get out here. We do have volunteers right now that are going at different depots and picking up milk during scheduled times. That's really something that happens pretty often in the metro area, going out to St. Cloud and some of these other spots. But some of these other places that are a little bit further out, like Roseau up toward Canada and Stone, Wadena, we have a service we have a partnership with Angel Flight that allows them to fly, these volunteer pilots to fly out. And as long as the milk gets to the local airport in these different areas, the Angel Flight will fly it back to us. And even for some of these ones, I believe with Roseau, the last time it happened, everything was sent out. We sent out some coolers for them. Everything was back without, say, 5 hours or so from the time they flew out to the time they got back. So it's really, really nice to have that service available to us for some of these depots that are a little bit further out from the Twin Cities.
So this is Linda Deck. As far as I know, Jeannie still hasn't been able to join us, so something must have come up at her hospital. So I will take her slides and just go through them quickly. I don't know exactly what she was going to do, but she wanted to share her journey of getting a depot going at St. Cloud Hospital and Clinic there. We have Jeannie actually helping us at the milk bank. She's a board member currently, and helping us with a variety of projects here. And one of them, we've asked her to be a mentor, a depot coordinator, mentor for any other depots in our state that would like to have questions for someone who's actually up and running internally a depot. And as Jason had mentioned, our depots are not milk banks themselves. I think there's a little bit of confusion about that, but they're collection sites. They're collection sites for the milk bank in order for us to be able to send our approved donors milk someplace to get it to the milk bank. So I think Jeannie was wanting to share about how she got the depot going at her site. At Centricare, and how it involved the different stakeholders at the hospital and getting the leadership involved and engaged. It also was about sharing it with the community. As Jason mentioned, it's a great way to connect, the outreach in regards to sharing about breastfeeding when you can share it with the community. And it's good news to share, which is what we all need right now. And how that can happen. Finding a space and for the freezer that's secured, whether the freezer can be locked or whether it's in a space that can be locked or only admittable by key card. And then I think Jason mentioned already about getting a depot manager. Jeannie is their depot manager there. She does the promotion through flyers in all of the patient education materials that go to them at their education classes. They're available in the clinic and on their intranet, I believe, through their staff. They have quite a few staff who go through the process of becoming approved donors for the milk bank. And then I think about once a year or so, near the anniversary of when the depot opened, she puts out an update in the intranet so staff can see how much milk was donated and some of the recent activities there. And she takes some pictures and shares that as well. And then as part of being a depot mentor, if people had questions or in terms of what goes on internally, we're on the outside of it, I guess, and we thought it would be a good idea to have somebody on the inside who is going through that, and in order to be able to share how to run a depot or what some of the issues that may come up along that way. So that's what she is offering to do. And then I just included this picture. And then she mentions that she does curbside drop off in terms of what's happening now due to COVID, and using PPE in order for this to happen. And then we have this picture already from what U of M or M Health Fairview does, and it's kind of just demonstrates that everything can be done curbside and safely in order for milk transfers to come. And that is Jason and one of our donors, approved donors, who is dropping off the milk in the blue bags. So, and then this is Jeannie and Dave Walls, and they're just pointing out their location during their depot opening when that happened. So yeah. And unless Jeannie, if you're on, go ahead and share. But if anybody has any questions for either Jason or I, please feel free to ask.
This is Linda Kopecki. Jean's not on. I think that she might have been caught up with a patient. And I don't have any questions in the chat section yet.
Okay.
But if anybody does have a question, feel free to list it. But thank you so much. All about milk banking and just making it very practical and user-friendly at the local level. So anybody with a local, regional, or cultural coalition can work at a maternity center to potentially set up a milk depot. The next section is about resource lists. Carrie Clun is a colleague. She works at Minnesota Department of Health. She works alongside Marcia McCoy. And she works with the peer program with WIC. And she's going to be talking about resource lists. And just one comment quickly about resource lists. And I've worked with a lot of different local coalitions and very brand new coalitions. And usually what they'll say is the first thing they want to do is put together a resource list. And that's a great place to start, but it's not the place to end. It's not the magic bullet that can solve everybody's problems, but it is a really good place to start. Getting your resources together, making sure everybody has access. It's a wonderful way to assure continuity of care, but it's used in collaboration, in conjunction with other connections and other ways to make sure that the warm handoffs actually happen and no family falls through the cracks. So I'm going to hand this off to Carrie, and you'll have another breakout session after this to discuss resource lists. You can go back and discuss the data, but you'll be with the same people in the breakout sessions. Thank you, Carrie.
Great. So like Linda said, I'm Carrie from the Minnesota Department of Health WIC program. And I think Linda brought up a really good point that a great resource list can be a good start. But it's not the end. It just really is that starting point. And I think the ongoing, struggle with keeping a resource list up to date has gotten even more challenging with COVID because everything has pivoted to, virtual or different settings or reduced capacity. So keeping that up to date has been even more challenging. The Minnesota Department of Health has partnered with Cofective starting last spring to have an online directory. And when they first launched it, it was really just an internal facing partnership sharing directory so that you could kind of almost like you're on a social media platform where you're friending the partners that you're working with, and then you can see them and they can see you and share your information. They just added a feature this fall where you can also choose to have your profile shared to the general public, so that we could use this as a resource directory for families who are seeking support for breast and chest feeding, can go on and search in their area by what kind of service they're seeking. So I think this will be a really nice tool that can always be up to date because you can go in and update your profile at any time. And you can also see how recently someone else has updated their profile, which has been really helpful because sometimes I know when I was working in the hospital, we were always calling around every time we were going to reproduce our directory to make sure that we had the correct contact information, the correct, location, hours, address, all of that kind of thing. And so this one is nice that you can see when those organizations did update their list to make sure that you have that up-to-date information or reach out if it's kind of dated. So if you already have a profile on Community Match, if you've already been added, the only thing that you need to do to make your profile available to the general public is to click the display my organization's profile little checkbox, and then you will also be visible to the external facing community. And then once you're within your profile, you can add a lot of information. So I have the Department of Health WIC program as an example that we've added our hours and location. You can also add documents. So you can upload any brochures or handouts that you would want to provide to participants. And you can also put in links. So you can also add, information directly to your website. You can also add your website link, any social media links that you have. And then under contacts, you can list as many contacts as you want. And these aren't necessarily people who are using this platform. They're just it's just part of your resource list. But you can also choose to add these contacts also to be users so that they can update this platform as well. So we recommend having at least 2 people from every organization in your partner profile so that you have somebody who can update it if someone leaves your agency or is on a leave or anything like that. And then within the programs and services section, you can add detailed information about any classes you offer, visits, teleconsult, support groups, the dates and times that those occur. You can add a photo and a description about each of the services. You can let people know, what kind of costs or if things are free to them. So just kind of updating to really highlight any services that you can provide. And then, we definitely are wanting to grow this list because the resource list is only as good as how many participants are on it, and making sure that everybody is represented in our community. So if you are already in a platform and you pull up your partner list and you think, wow, all of the key partners in my area aren't yet added, you can click this blue add or invite a partner button, and then you'll see if they've joined the platform, but you haven't friended them yet, kind of where you are connected with them. If you don't see them on that list, then you can add them by just putting in their email, and then an email will automatically go out to them, encouraging them to join. So if you are joining us today and you don't have a profile yet, I will put a link in the chat box to this survey where you just fill out a little bit of information about your organization, and then you will get an email back to set up your profile. We are also having a webinar to explain a little bit more about the Community Match platform on January 7th, so feel free to join us at that if you wanted more information. And then Cofective is also going to be having office hours, so they are available anytime on that Community Match website for questions by contacting them by email at this solutions, or Amber is our contact. You can reach out to them. But if you go to the office hours that will be starting next Friday from 9 to 10, you'll get a Zoom link. So you can immediately connect with somebody who's live, and they could walk you through any questions that you're having about how to set up your profile. You can share your screen and they can kind of walk you through the process. So if you have any questions or are feeling kind of daunted by the process of adding yourself in, that can be a great tool to help you get started. And then Shoshana Kraft has volunteered to kind of give us a little overview of the profile that she created to kind of give you an example of what your organization can do.
Hi, good morning, everybody. Can you hear me? Okay, I actually have 2 Zoom links open on here. One works and one doesn't work. It was actually fairly easy. I think originally when I got one of the first emails last year in 2019, I was very interested, but I didn't get around to doing it till this year when I had more time at home this year. So it was really important to me, especially during COVID, to get some more information out there for our families that are out in the community, because we have reached a lot of families across the state, including 15 other states and up into Canada with our virtual support circle. And so I saw another email this year. It's basically easy. You just go to the cofective.com. Is that right, Carrie? Cofective.com. Yep. And then you click on the link and then you request to add a profile. And it was just that simple and easy. And once they approve for you to request your profile, you come back on, and then you go to, you fill out the information about your organization, your name, all the information that you need to add on there. If you have a website, we don't have a website just yet. We just have a Facebook page, and that's how we reach many of our families. And then there's more that you can, there's more information you can add, what kind of services that you provide. For us, it would be, lactation support and perinatal support, full spectrum support. And then even just this morning, I requested to add another organization for my day job. I do family home visiting with the Family Spirit program. And it's very easy. It's not very hard. Doesn't take very long at all. So I would encourage everybody to, it's very user friendly. Go ahead and try to sign up and add your organizations and add us as a partner in your with your organization. Thank you.
Thanks so much, Shoshana. So we're going to move to breakout rooms in just a minute. And the thing that we thought would be helpful to discuss is, which resource guides are you guys currently using in your community? Is it from WIC? Is it from public health, family home visiting, hospitals, clinics? Do you guys all have your own resource guide and you share across each other? Do your local, regional, and cultural coalitions have a resource guide that are combining some of the resources from those various groups? And how can MBC assist in developing and disseminating the resource guides across the state? So
there was one question that came up in chat. Could you please, in the chat section, put the link, the basic cofective.com? Yes, Shoshana put that in there. Thank you, Shoshana.
Oh, thanks, Shoshana. Great. Any other questions? Yeah, I didn't think to ask because I can't see the chat right now.
I don't see any other questions. But for the breakout, you'll be with the same people, the same. Feel free to, in the breakout sessions, to continue discussions about data if you want, or feel free to move on to resources. A lot of times there's overlap. I also wanted to mention that Jeannie Freeby, who we were talking about quite a bit with the milk bank, is on now. So maybe after the breakout session, before we talk about the 10-step learning collaborative, we can spend just a minute or two catching up with her. So let's go to the breakout sessions now.
Great.
Hi, everybody.
Sorry, do you see that Dee's phone?
Yeah, I was just gonna send a message.
And
you can hear us, Dee's iPhone. If you want to let me know which breakout room you would like to go to, but also send you a message.
Yeah, and the breakout rooms are by region. So what region in Minnesota are you in? Dee's iPhone. And then Jenna Walter also needs to go to a breakout room, and as does Shoshana.
I'm wondering if Shoshana's other...
I closed out my phone,
okay.
So I have a computer now with no video.
Oh, okay. Thank you so much for jumping in and pivoting with all of your... I've had to do that. I presented on my phone, but then it's on the computer.
Yeah.
So do you have Jenna Walter in a room?
She is in Northeast, and
okay, there she goes. And then Dee's iPhone.
I haven't. Let's see.
So welcome back as people come back. I hope you had a good discussion. I know people are slowly coming back.
And I shared in the chat the link for the general Cofective website, and then also the Airtable link is how to request to add a profile for your organization. And then the first link for the webinar is not working, so I put in the correct link there seconds. And then feel free to reach out to me if you have any questions. I'll put my email in the chat as well.
I just want to, before we move to just a small piece about the 10-Step Learning Collaborative, and remember that this teleconference is all about how coalitions, so local coalitions, cultural coalitions, regional coalitions can partner with their maternity centers to improve optimal infant feeding rates. And that's initiation rates happening in the hospitals, duration rates that are more focused on work done in the community. We've talked about data, we've talked about resource lists, talked about milk banks. We will be talking about the 10-Step Learning Collaborative. I wanted to very quickly just say that Jeannie Freeby is back. She joined a little late. She's the Milk Bank Depot mentor. But she was working with a mom, which is, you know, priority, of course. So Jeannie, I just wanted to give you a chance to say hello to everybody and just to connect with everybody really quickly before we move on.
Well, hi, everybody. Yeah, contact me anytime and I'll get you fired up about having a milk depot, that's for sure. It's just been quite a learning situation. It makes you feel really good. It's just doing really good work and takes a great team of people, and we've got that. I was thinking of all of you though, being late. The patient I was with was 16 years old, African American, and you get to meet people and make a difference. And I mean, it was just like, I wanted to get away, and it's like, no, I don't want to leave her, you know, and it took a lot longer, but it was good work. So that's where I was. So you all forgive me. I know.
Thank you. You are an amazing asset to us. Thank you.
Oh, back at you. Thanks.
I want to pass the baton to Carol Bussman. She is under a contract with the Minnesota Breastfeeding Coalition, and she's providing direction for the 10-Step Learning Collaborative. And that's a wonderful cohort model, working with hospitals that want to make improvements in their policies and practices around breastfeeding. It's aligned with the Baby Friendly Hospital Initiative, but it is really Minnesota's own homegrown way to improve policies and practices. So Carol, if you want to share your slides.
I will.
Feel free to take it over. And I just am doing a time check. We have 18 minutes left for the teleconference and we are totally on time. So thank you.
Are you able to see the screen?
Yes, thank you.
Yep. Okay, all right. I apologize. I was a little bit late this morning as well, but I'm here now, which is good. And I thank you for this opportunity to share about the Mother Baby 10-Step Learning Collaborative. Just a little bit about myself. I've been in nursing for more than 40 years, and I've worked in small hospitals, larger hospitals, hospital systems, and I've been a lactation consultant since 1990. I've assisted hospitals with baby friendly, but I have a passion to help mothers get going and families get going with breastfeeding, and not only initiate, but then continue on. And personally now I have grandchildren who it's been great to see exclusive breastfeeding and then continue on well past years. So, but I want to start with the big picture, the World Health Organization and the 10 steps. It's almost 30 years old that this has been an initiative. And I want to just talk about that. 1991, they had the 10 steps, and these steps are associated with improving breastfeeding initiation and duration. They also have the International Code of Marketing of Breast Milk Substitutes. So that launched things for the big picture. Baby Friendly USA, and some people get these confused, is really responsible for the adoption, the coordination, the accreditation for baby friendly official designation in the United States. This is a rigorous process that goes through. So we start the world, we come to the US, and then I just wanted to briefly review what are the 10 steps. The first two have a little bit more to do with the management of a hospital, is that they've got a written policy that's communicated, that they are compliant with the World Health Organization's code. There's ongoing monitoring of what is going on with breastfeeding metrics. They train all healthcare staff in the skills so that everyone's on the same proverbial page, but also that they also are promoting the best practices. Then you get to the key clinical practices and informing all pregnant women about the benefits and the management of breastfeeding. I think coalitions and communities are involved in addition to the healthcare provider for pregnant women about this. Step 4 begins in the hospital with or birth center or wherever birth occurs, helping mothers initiate breastfeeding within the first hour of birth, facilitating that immediate uninterrupted skin to skin, which we know is of benefit. And that is true for every baby, that's skin to skin. Then step 5 goes on to support mothers to identify latch, position, just some common breastfeeding issues, as well as if mothers and families have made a choice, an informed choice to formula feed their infant, that how to prepare formula for their babies. Step 6 goes on, giving infants no food or drink other than breast milk unless medically indicated, because we know the best way to establish breastfeeding is to do it that way. Step 7, practice rooming in, allows mothers and infants to remain together 24 hours a day. And this is true for every infant. Mothers, families get to know their babies. They don't take home a stranger. They've had a chance to try different cares for their baby. 8 is responsive feeding with no restrictions. It used to be called on demand, which kind of bothered me a little bit, but really responsive to the infant's hunger cues, as well as formula feeding skills. Step 9 is giving no pacifiers or artificial nipples to breastfed infants. And again, step 10 is really a link to communities and promoting the duration of breastfeeding, fostering support groups, referrals once discharged from the hospital or birth center. So we talked about World Health Organization with the 10 steps, Baby Friendly USA with the 10 steps, and now we're going to go to the Department of Health. This is actually a screenshot from their page. On the left-hand side, you can see that they have 4 areas where they recognize breastfeeding friendly. And I think someone mentioned their workplace or their health department. Those are places as well as childcare. Workplaces, health departments are for staff and employees, but recognizing maternity centers is really about the patients. And this is accomplishing, again, these 10 steps as defined by the World Health Organization and Baby Friendly USA. And this is an incremental process. So just some highlights of the Department of Health's breastfeeding friendly recognition. It is based on the 10 steps, although it has no formal relationship with Baby Friendly USA, and it's not meant to be a replacement for it, and it won't fully prepare a hospital to go through Baby Friendly, but it begins and helps you look at what are the processes in the hospital that go. There's no fees associated. It's not that you have to do all 10. You don't have to start with 1, 2, 3, 4, 5. You know, and then with the state is if you complete two of the 10 steps, you get 1 star. All 5 stars mean that you've completed 10 steps. Little bit about What does this have to do with the 10-step collaborative then? The CDC awarded a grant to the Department of Health, and it's been operationalized through the Minnesota Breastfeeding Coalition. And the goals of the grant are to increase the number of maternity centers that have action plans, to implement at least 2 of the 10 steps in the environment of a learning collaborative, and then also they would apply for the Department of Health's breastfeeding friendly recognition program. Briefly, what is a learning collaborative? It's a quality improvement process where you have groups that meet from different organizations, in this instance, different hospitals, and they meet regularly to improve the specific practices related to breastfeeding. And it's responsive to who is in the collaborative. We learn from each other, and it's a way to improve the quality of your organization. So initially, the 10-step learning collaborative project was begun in August of 2019. And the first learning collaborative actually met in November last year via Zoom, before Zoom took such a prominent place in our lives. And there's 4 hospitals, and we have met. They have developed great assessment of their organizations, of where they are with each of the 10 steps, and then determined which 2 steps they wanted to work on. But we also acknowledge that pandemic has significantly impacted the work, all of us, but the work done at a hospital, of course. And I have to say that these 4 teams have really kept this focus despite their pandemic work as well. So they continue to be passionate about helping their families, and the CDC grant was extended. And so we are extending an invitation to other hospitals to join the collaborative, and they can schedule informational calls at their convenience. I'll meet with them, as it works for them. And you can email myself or Linda Kopecki as the Minnesota Breastfeeding Coalition Director with the 2 emails. It's been great, and I'd be open to questions.
So there is one question in the chat section that I thought was really interesting, Carol.
Yeah.
And it's from Jenny Crow. Hi, Jenny. Haven't seen you for a while. And just about the role of families, because definitely we're talking to folks who are with local coalitions and cultural coalitions and regional coalitions, people who are out in the community, and the role of families knowing about the 10 steps. And I know in some communities, they really do advertise baby-friendly hospitals as, to the community, so that there can be a demand for baby-friendly hospitals created, or a demand for improved policies and practices created within the community. But I'm just wondering if you have a thought about letting families in the community know about 10 steps.
That's a great question. I know organizations that go through 10 steps, part of that is that they communicate the 10 steps to families that come to them. But I think this is partly where the influence of coalitions letting their communities know there are 10 steps, and positively influencing local hospitals to look at it. We would like to consider this, because we know that the more of the 10 steps that are implemented, the better outcomes there are for breastfeeding, not only initiation, but then the duration when you hand off to communities. Is that kind of answering?
I think so. Thank you. Thank you very much. So before I wrap up and say thank you, I need to backpedal a little bit. I have a poll that I wanted to have everybody take that was related to resource guides and resource lists that I forgot, but I'd like to use that to launch it now. And so this is I'm with the Minnesota Breastfeeding Coalition, and we want to be your resource. We want to support you and be a resource to you, and help you continue to do the amazing work that you're doing in the community. And my poll is, Carrie, I think you have to pull up the poll. Because can you pull up the poll?
Okay, yep, I'll launch it now.
Okay, you can launch it. Okay, so please complete this poll. And Carol and myself, we cannot do the poll. So Carrie, if it looks like a number of people have completed the poll, I think we can share it.
We're about 75% at this point.
Okay.
Maybe we'll just give you guys.
You do need to click on submit for submitting your results, your responses.
All right, should we say last call for poll participation?
Definitely. Okay, let's see those results.
Can you see the results, Linda?
I cannot.
Oh, okay. So we have about 61% is the highest ranking for ideas from other communities, followed closely by a tie with help with Cofective and ideas on ways to maximize the use of a guide or list. And also a template for a resource guide.
Carrie, would you take a screenshot of the results, please? Because I want to be able to respond to that.
Definitely.
Thank you. And I just want to acknowledge, thank you so much. And I just want to acknowledge that several people have shared their resource guides in the chat section, which is excellent. Thank you so much. One actually shared their year in review. And I think we're going to take final questions. We just have a minute or two left. Actually, probably less than a minute. But if anybody has any final questions, please let us know.
Carrie, could you repeat next steps for people who are interested in help with Cofective, since it was on the poll?
I'll put in the chat the links again for how to create your profile or request a profile to be created, and then also my email. So feel free to reach out to me directly with any questions. And then we're having a webinar January 7th to kind of go over the Cofective process again. So definitely don't hesitate to reach out, and I'll throw those links in the chat again. Thanks.
Mm-hmm. And again, I'm going to send the PDF of all the slides to everybody. So you will get all these links. I want you to open up your January calendars, please, right now, and mark down January 21st, the morning of January 21st. We don't have the time exactly yet, but we're going to have a winter workshop, and this is going to be all about eSERPs. So if you are needing eSERPs, we're hoping that we get these approved for eSERPs. So it's policy, laws, and ethics expressed in chest feeding friendly environments. The main speaker is going to be Jessica Lee, who is a staff attorney with the Center for Work-Life Law in San Francisco. And she's done quite a bit of work on this. She runs the Pregnant Scholar program, and it'll be an exciting conversation. And we're going to talk about childcare and other pieces too, and have some local speakers. But workshop coming up January 21st. I'm going to quickly see if there's anything in the chat that I need to refer to. Does anybody see the chat section, and if there's anything I need to comment on?
No new chats.
Okay, so I just want to say thank you for attending. Very excited that everybody was here, and nice to have a second teleconference. And I'm hoping that we have at least 2 or 3 teleconferences every year now, because this is a great way for coalitions to connect and to share with each other. Thank you, everybody.
Thanks so much for joining.
Thank you.